One of the key objectives of the UNFPA supported study that we were supposed to do, we did only phase 1. We were going to do phase 2, but the cost involved, now she has done it. But we did not know that she was doing it. That's a fact. It is important for us to, if you talk to your lieutenants in Mankasim and Tamale, they only know the number of research teams they are serving, all within this Fistula sphere. And I think if we put our efforts together, we'll save costs, we'll save time, and I believe we can do more and be more impactful in breaking the cycle of
as long as we have new cases coming, as long as we have people delivering at home, as long as child marriage continues, and then birth remains shrouded in some culture, we are bound to be having more fistulas. We also want to say that because the repair is expensive and we cannot even cost the effect of fistula on these women, prevention is very, very key. To those who have had the condition already, they need to be integrated. And I want to share, when we've been doing follow-up studies, the last study, the women get repair and they have some euphoria, they are happy. Few days after the repair, then the woman says that people are still looking at me in some way. I still don't have a job. I can't even eat. But now the water has stopped. So the woman goes like, well, madam, I'm healed, but. So we want to step in and fill the gap of I'm healed, but. Come join us and let's save this woman.
Oh, me am a patient, bad 2 months. Some said you, me are all by 7. I'm not going to 7. Find a man, I think it's you. Now, doctor, now, let's say, Chima, which you say, doctor, me none in our argument, it's no Kuranamanda. Meaning, I'm saying, it's in me. Now, we walk out for another Tabaku, give my demonstrants, I got coming on this summer, for the Nanunko. Now, where did me back and then my minute or coffee about or maybe about 5 or 22 years. My rose on a tinty gram of me bad legend because Sada man, you so can still be done on Flama. That's my big carol. Me bad that's not enough for me calling this cow post now, but I'm for you yet. The bed in the nice for me was Namia do my yes, Camu, and I double quite theatre. The letter says I had the mammy.
The EA Fistula Care Ghana is a non-profit seeking organization. We have a vision of being the leading fistula foundation in terms of breaking the cycle of obstetric fistula. By that, we believe that it's not just about looking for cure for them. We believe that we should also be able to reintegrate them after they have been cured. So we want to demystify what fistula is. We want to tell the whole world that fistula is not a spiritual disease, that fistula is a medical condition that could only be treated with surgery. We also want to play advocacy roles in development of policies and also in support, helping others, drawing other people's attention to the plight of fistula women and bringing them on board to support women with fistula. That's basically what we want to do. We also believe that we should carry out more researches and dissemination so that people will understand what fistula is and then also be interested in carrying researches in fistula. When the woman gets fistula, already she's so disturbed, she's so disorganized, she's prone to mental problems. So that is not the time to shun the woman or maltreat her. You give her love, you show her attention. It's not the end of life. It is curable. If you contact us, we can link you to where you can get help. Even if you don't have money, we can still organize and get money to support you so that your woman will be fine. So support her, don't divorce her, it is curable. So the way forward is to go into the interior because these women are hiding, they scarcely come out. So we want to go deeper into the interior to really look for them and help them regain their dignity and also support their children.
It is very welcoming news for us to hear the Ernestina Asedua Fistula Care project being launched in Ghana to also lend support to work already ongoing to eradicate fistula from Ghana. This is a very commendable effort, particularly when it was informed by a PhD research work and an encounter with a fistula patient. This is very touching and she needs to be encouraged and supported as much as possible. The major bottlenecks for fistula care in Ghana is our inability to recruit the patients, our inability to find them, and our inability to recruit the patient. And I saw as one of the bullets for their core functions or deliverables would be to improve fistula patient recruitment. So that for me is welcoming news. Remember, I'm a fistula surgeon. So if you can find them and we can fix them, then we help to cure them and reduce the numbers suffering from obstetric fistula. We need to also, as a matter of urgency, do our best to sustain awareness on fistula. Often we publicize it during the International Day to End Obstetric Fistula, and after that we all go to sleep until there is another International Day to End Obstetric Fistula in May. But with what Ernestina has done, at least we've had the opportunity to talk about fistula in October. So sustained awareness will be an important component to helping to eliminate fistula in Ghana ultimately.
I'm really greatly delighted to be at the launch of the EA Fistula Care Ghana. Indeed, the research done by Dr. Ernestina Asedua has provided real concrete data. And the good thing is that it explores the socioeconomic, cultural, and religious beliefs of these women and of the society in general that really led to the condition and affects the condition, and even after the surgical intervention for cure is done by the women, how these women get integrated into the society and to get their lives back, as it were. So I'm particularly excited about the work and about what the foundation seeks to do in creating awareness about the condition of obstetric fistula, which means that a woman, had problems during labor, couldn't get access to deliver in a hospital, if I should say, and to have most likely a surgical intervention that leads this woman later to be leaking urine and sometimes feces or both. And so this work is going to create awareness in our community so that people are going to access care in hospitals for delivery. That's what we talk about, supervised delivery, so that people won't say they are delivering at home, or even, if I should dare say, traditional birth attendants. They would rather go to hospital because that is where we can really care for them and offer them what they need. We are also the NGO is going to also train health workers in general so that we'll be able to, as it were, create very nice and good environments within health facilities that would encourage all women to want to come to health facilities to deliver, because they will find our facilities to be friendly, and therefore they would come and deliver there. And most importantly to also provide care for women who have unfortunately suffered the condition, be able to provide funding for their surgeries and the needed support, medical and social support. And then after they have had the surgery, to be able to reintegrate them back into their society. Because sometimes, because these women are smelling of urine and things, they get ostracized by their own families, by the communities, by the society. So to be able to integrate them back into the society, to let them know that, look, this is not any strange disease caused by any, forces or anything the woman has done. And so be able to give them some also employable skills so that economically they can, hold themselves together. And I believe that with that, they can integrate well into the society. So we are happy for this inauguration, and we hope that the foundation or the NGO will be able to achieve its aims. So, as an obstetrician gynecologist, I've handled women, I've treated women who have this condition, and what I'll tell women who are suffering from this condition to know is that there is care available for them. They should go to the nearest hospital. If they go and they cannot be helped there, they'll refer them. And also when they are cured, in a way they should know that they are cured and be strong and not to listen to what society would say. Sometimes, people would say things about you, but you need to be courageous and to stand strong and to get your life back and reintegrated in the society. And to the public, I'll say that obstetric fistula is a medical condition. It is not spiritual. It is not, because of the woman's fault. And that we should not stigmatize such women. We should rather support them to go for care. I've seen people suffer from fistula for 10 years, living in literally walking distances from where they can receive care, just because of either they don't know or because of the stigma. So we should all encourage people that we know who are leaking any of these things to get to hospital for care, and we should support them.
Like the speaker there said, we won't usually to attribute such situations to maybe witchcraft, curse, whatever. But today, quite clearly, we have been made to understand that there is a scientific basis for the condition and that it is treatable. It is not doomsday as perhaps some of us may be minded to look at it, and that with the proper attention, with the holistic attention to the whole thing, there is prospect for treatment and redemption for people who have the misfortune of, suffering this ailment. So today, like the signpost there, fistula is treatable. It is possible to give people hope, and that is what the EA Fistula Ghana tells us, and I believe that it is a source of tremendous hope for people who may be involved in the treatment. It gives hope to everybody, and I congratulate the woman for this initiative to give hope for redemption for patients. It's like Saul's experience on the road to Damascus. My eyes have been opened, and I know that there's something much more we can and should do, to help, women who have this problem, because we have a testimony from the people who have recovered from it, and that with the proper attention, with the proper assistance, with the proper motivation, it is possible to come back to normal life.
Thank you for watching Nation One TV. Kindly subscribe for more news updates.